my pleasure to introduce our expert speakers, Aurora GrantWingate and Mikayla Trujillo. Aurora had the honor of joining the National Association of Community Health Workers in October 2020 as the Member and Partner Engagement Associate. She is one of the original first 3 staff members of NACHW. Throughout her time at the organization, Aurora has overseen the development and growth of NACHW's COVID-19 portfolio, including NACHW's partnerships with the Vaccine Equity Cooperative, the National COVID-19 Resiliency Network, and the Community-Based Workforce Alliance. In addition, Aurora has had the pleasure to connect with hundreds of CHWs and CHW networks throughout the country to connect them with trainings, grant opportunities, and help foster community building. Mikayla has strong roots in Albuquerque, New Mexico. She is a peer with lived experience around overcoming adversity, including mental health, substance use, and incarceration that ultimately led to her becoming a certified community healthcare worker in her community and the capacity building coordinator at NACHW. Mikayla is currently leading the Johnson & Johnson CHW Leaders Project and offers mentorship and support to the inspiring and groundbreaking individuals in the CHW leadership community. In today's Health Bites, they will give a presentation on the development of the National Community Health Worker Survey to advance professional identity, policy leadership, and organizational capacity. Thank you so much, Aurora and Mikayla, for being our expert speakers this morning, and I will turn everything over to you.
Thank you so much, Margie. If you don't mind, I am going to go ahead and share my slides. So I'm going to request that privilege, but thank you so much for that wonderful introduction. As you've already heard, myself and Mikayla are going to be your speakers today. I am going to kick us off on our presentation. I'm going to start at the very beginning, sort of talking about who CHWs are, who CHW networks are, who NACHW is, and a little bit of the work we are doing right now. And after that, I will hand it off to Mikayla to talk a little bit more about the Johnson & Johnson Leadership Project and a little bit more about this new national survey. So I know this might be something that some of you on the folks know some of you folks on the call know very well, but I first want to make sure that everyone has a clear definition of who a community health worker is, or as you might hear us refer to it throughout the webinar, a CHW. So CHWs are trusted messengers and members of their communities. They often share life experiences or have expertise in the focus areas or with the communities that they are serving. They go by many titles. We use CHW as an umbrella term for many different job titles, such as promotoras de salud, community health representatives on tribal nations, peer support specialists, outreach workers, and so many more. And here on the slide, you can see some wonderful photos we have of some of our board members and CHWs doing outreach in the community during the COVID-19 pandemic. So why community health workers? Why do we at NACHW believe that they are so important? We right now, and this is more apparent than ever, have a public health worker shortage. And we need more people now than ever to be out there in community educating around public health. There's also a weakness in pandemic readiness, which community health workers can help address. Community health workers also reduce cost of disease by prioritizing the social determinants of health. Those are things that around housing and social services that folks need in order to live healthier lives and to achieve racial and health equity for marginalized communities. Community health workers are overwhelmingly from these marginalized communities themselves. Community health workers are more likely to be women and more likely to be women of color. And they are sharing those, they are serving those same communities and working to achieve racial justice. So then what is a CHW network? So NACHW is a CHW network, but there are also dozens of other CHW networks at the local or state level. These are organizations that are co-led and founded by community health workers whose missions and activities focus on membership and networking, policy and advocacy, and so much more. We want to encourage anyone who is a CHW or working with CHW to get in touch with your local or state CHW network, to be connected with trainings and advocacy, policy development, and so much more. You can find a list of those organizations on our website. And now sort of the final setting the stage piece of this puzzle is who is the National Association of Community Health Workers, or NACHW as we often refer to it. So we really have a common vision of uniting community health workers nationally to support communities in achieving health equity and social justice. We are first and foremost a membership organization. We work with engaging CHWs and allies, key stakeholders, and others to educate about CHWs and their importance to our realm of public health, to enhance leadership and professional identity for CHWs and to give them more opportunities to take up positions of leadership. We want to educate stakeholders on the impact of CHWs. And we want to establish a national voice and a centralized body for folks to be able to go to with issues related to the workforce. NACHW is now very proud to announce that just starting this fall that we now have members in over 50 states, including Puerto Rico. We have about 2,500 members. It's good to know that that is just a very small, being over 100,000, but we are a growing organization and we're very proud of the representation that our membership represents. I also want to give people an idea on where community health workers are working. Community health workers are overwhelmingly employed by community-based organizations, sometimes known as CBOs, and then smaller percentages are employed by health systems and hospital systems, federally qualified health centers, and then a smaller percentage in universities, in public health departments, and more. And as you can see, ally employers are also being employed by community-based organizations, universities, and so on and so forth. I also want to give folks an idea of the range of topics that community health workers do education and outreach around. So these are just a couple of the main primary areas of expertise of our membership, which includes housing and basic needs of community members, immigration, diabetes education, women's health, men's health, mental health, material and child health, and so much more. These are really just the primary, but community health workers have many different areas of focus and expertise that they do work in every day. So one of the things that NACHW provides is doing advocacy and legislation recommendations. Over the 3 years that NACHW has been around, we have put out many different reports around the CHW workforce, around statewide training and sustainable financing, what CHWs need during the pandemic, and general overviews of the workforce at the state and local level. We continue to do work around advocacy and engage our members and to see what their priorities are and advocate for those on a national level. I also want to highlight, oh dear, okay. I'm going to have to do this for a moment, my apologies. I also want to highlight the CHW Document Resource Center that lives on our website. As far as we know, this is the largest collection of CHW documents that exists in the United States. So you can visit our website and look up basically anything that you're interested in learning about related to CHWs. CHWs are a studied and a field that has proven themselves. There are studies around all sorts of different areas of expertise for CHWs, such as diabetes education, HIV outreach and prevention, things around legislation, things around creating CHW networks and organizations run by CHWs. So if folks have interest in any of that, I hope that you visit our Document Resource Center and start to learn more. I also want to highlight a little bit the work around COVID-19 that the National Association has been working on. So NACHW came together right before the pandemic at the end of 2019. And as you all know, then shortly after that, we were launched into this world of the COVID-19 pandemic. Community health workers have been on the front line of COVID-19 since the very beginning. Even though CHWs are often not given the recognition around their work during COVID, they have very much so been present, doing work in the community, doing education around masking and testing, and then later down the line, COVID-19 vaccines. NACHW has gotten the pleasure to speak with thousands of CHWs about their work around COVID and find out what their needs are during COVID, which often revolve around access to PPE, access to hazard pay and things like that to be paid properly for the risky work that they can be doing outreach during COVID-19. And we have had the pleasure to make many different materials for community health workers in various languages that they can use in their COVID-19 outreach. We've also had the pleasure to help co-found different organizations doing response to COVID-19, such as the Vaccine Equity Cooperative, the Community-Based Workforce Alliance, and various other organizations. We have gotten to make recommendations to all sorts of different COVID-19 initiatives who were looking to expand their work with community health workers. So this is a work that continues to be very relevant. Community health workers are now more than ever being acknowledged as an important part of COVID-19 response. And we are now in this moment seeing them being acknowledged on the federal level in a way that's really unprecedented. Biden's Build Back Better acknowledges community health workers and calls for hiring community health workers as part of pandemic readiness, as well as there have been many grants through HRSA and the CDC around getting public health departments and community-based organization money to hire and train community health workers. So more to come in this area. I am now going to pass it over to Mikayla to talk a little bit more about our CHW Leadership and Capacity Initiative. Thank you.
Thank you, Aurora, and thank you for sharing the history of CHWs and the far reach of NACHW. So at NACHW, we believe in an equitable and respectable role for every individual to serve their community in the healthcare sector, regardless of color or social class. We empower and raise up those who are active in their communities, offering services and resources to people in need. We uplift and build a firm foundation for the CHW profession by providing authentic education, the latest news, synchronized data, and policy reform. We understand that CHWs are at the heart of socioeconomic barriers and are closest to the solution, but often furthest from the resource. We propel the CHW population by inviting some of the nation's greatest CHW leaders to create a community and virtual workspace to enhance and unify the CHW profession with respect to the authentic identity of the workforce. We have leveraged our virtual workspace to create a small work group that reaches far beyond a single level community to disseminate information and education through a national survey and capacity building webinar. Next slide, please. As you've heard, we've gathered 10 of America's most unique and culturally rich individuals who serve our most vulnerable populations. Out of those 10, a few facilitated our capacity building series in 2021. The Capacity Building Initiative was born in an effort to reach much further than a single community. CHWs leading the NACHW project wanted to emphasize the importance of lived experience and communities working for themselves. This project has educated and promoted CHW roles, the acceptance of CHWs, recognition of their work, and respect for their values. Through engagement in this project, CHWs have amplified their leadership roles and those of other CHWs. They participated in policy development and have taken recommendations from this group to help states understand how to best engage and support CHWs. The impact of this project included state, regional, and national mobilization, building community capacity to advocate for CHWs' needs and a broader understanding of the public health through educating the community. We have uplifted the voices of these CHWs across all 50 states in a national webinar with professional-centered topics developed to create infrastructure and cultivate a virtual environment where CHWs can join with other professionals to co-create and implement programs, practices, and policies that achieve health and racial equity and social justice. Next slide, please. As a part of this workspace, the NACHW CHW leaders began developing a national survey. The goal was simply to document the current state of CHW's professional identity, policy, leadership, and CHW-led organizational capacity. As you can see, we are pictured here brainstorming what this survey could contain. This was all done by the capable hands of CHWs across the country, representing different languages, sectors, and experiences. They led the development of this survey and will continue to lead the survey analysis and next steps. This took months and months of dedication and brainstorming to develop the best practices for prioritizing the needs of CHWs to ensure that the data collected will answer those questions and drive solutions for workforce sustainability. We began to pull out themes for this survey with the highest importance around demographics, professional identity, CHW career pathways, leadership, and organizational capacity. We had a 6-month pre-survey timeline and many national stakeholders that contributed to the launch of this survey. Next slide, please. After that, we kicked off beta testing the survey with about 40 to 60 CHWs. Criteria for the survey was anyone identifying a CHW. That means anyone under the umbrella term of CHWs, including promotoras, CHRs, and CSWs. We produced easy communications for emails and forwarding using a Google form holding the 51 questions and their responses. Our distribution priorities were reaching CHWs who serve different populations, reaching partners in other regions, but most important is to utilize personal relationships from our membership and network. For the data to be valid, according to how many CHWs there are nationally, approximately 100,000 CHWs in the US, we needed at least 390 surveys to be completed for an appropriate sample size. As you can see, we far exceeded that goal. Throughout the 4 months, the 4-month timeline, responses began to flood in from across the country. Our CHWs wanted us to hear their voices and were eager to tell their story. Next slide, please. By November 2021, Dr. Sanjay Basu, head of clinicals at Waymart, California and Harvard, had laid first sights on the raw responses and was able to gather the data in Tableau and form some initial trends. They are how CHWs are paid and what, respect in the workplace, an increase in younger CHWs entering the workforce as a response to COVID-19, and geography-dependent employers. The CHW leaders were able to gather around this analysis and expertise of Sanjay to understand the emerging information and results the survey had produced. The CHW leaders will continue to lead on the dissemination efforts of the results in national streams and public marketing throughout 2022, documenting on our approach to developing CHW leadership in research papers and the results of the national survey. The analysis will be shared in a national workshop setting where the survey findings will become strategies to advance the CHW professional identity, policy, leadership, and organizational capacity. Back to you, Aurora.
Thank you, Mikayla. So if folks on the call are interested in learning more about the survey and the results, this is something NACHW is going to be rolling out over the course of the next 6 months, as Mikayla mentioned, and we're hoping to have the full report available sometime in the month of April. There's a lot of exciting data around the languages that CHWs speak and more data around how different ethnic groups are facing the CHW profession. We want to encourage you to stay connected with us at NACHW. We have a free newsletter that you can sign up for on our website at nachwa.org. We invite folks to sign up. We do news blasts probably twice a month around events and opportunities and resources. We also have a yearly Unity conference that will be virtual again this year in July or August. We don't have the save the date yet, but that is a great opportunity for folks who are CHWs or who are learning about CHWs to learn about what are the current issues, what is the current research, and what is going to be happening over the next year in the CHW space. And that's another thing that will be put out through our newsletter. We also, of course, invite folks' membership. Our membership starts at $20 a year for an individual CHW. We also have options for allies of CHWs and organizations. We love to stay connected and to hear from folks. So that is the end of our presentation. If folks have questions sort of after our presentation, please feel free to connect with us at info@NACHW through our website. Also, please connect with us on our social media platforms on Facebook, LinkedIn, Twitter, and Instagram. I know we ended earlier than expected, but I'm excited to hear if folks have questions that Mikayla and I can answer.
Well, thank you so much for that really wonderful presentation. So we do want to open up the floor now for any questions, so you can put those in the chat. But I'm going to go ahead and start off with one for myself. So I know that you've got a little bit of, you collected some data. Can you maybe elaborate on what trends you're seeing across the country in regard to the different roles CHWs are performing in communities?
Do you want to take this one, Aurora, or should I?
Yeah, sure. So first I'll speak sort of broadly about the roles that we know CHWs play. Some of the main roles CHWs might play is sort of linkages to social services, to housing, through SNAP, to Medicaid, as well as sort of doing education around public health that might be around diabetes or contraception, and many other sort of topics. Other roles CHWs might play is doing some coordination at sort of with medical homes or medical professionals, sort of coordinating appointments, helping folks stay up to date with their medications and things like that. Mikayla, I don't know if you want to expand based on a little bit what we've heard in the survey so far.
Sure. So just as Aurora said, the main position of CHWs is playing that key factor into the linkage of care. And they do that in so many different ways. We've seen violence prevention, crisis intervention, children and families, pretty much any sector that you can think of, there's a CHW there working so very tirelessly to uplift the efforts in their community. We have actually began to graph some of this, and I'm telling you, it's just a kaleidoscope of colors of how they describe themselves under different titles, different roles, different tasks. So just stay tuned. We've got some beautiful reports coming up for that.
Great. Thank you so much for that answer. So there are some questions coming up in the chat. So one of the first questions we have is, how can this person asks, become a community health worker?
Yeah, that is a fantastic question. And I feel like there are sort of two parts to the answer. One is we often hear folks coming to us and saying, you know, I actually have been a community health worker all my life. It might not be something that they're getting paid to do, but a lot of people describe it as sort of a calling. So one of my half of my answer is saying you might already identify as a community health worker. You might be doing some of that education and that help of your community. The other answer is sort of maybe more practical, you know, how do people get CHW sort of jobs? I would say a lot of CHWs are being hired through community-based organizations, through hospital systems, FQHCs. I know we're getting also some questions around certification. There is not a national CHW certification, but different states have their own processes for training, and some states have certification and some don't. So I would really connect with your local or state CHW association. That will be a one-stop shop to learn about training opportunities, certification, if that's a thing to consider where you're from, and job opportunities.
Great, thank you. That's a great answer. I mean, I loved hearing that. Lots of opportunities. So, a second question we have is: I've heard about CCHW, clinical community health workers. Is there a difference?
Yeah, that's a great question. CCHW also sometimes stands for Certified Community Health Worker. So that often means that that is someone who lives in a state or area that has a certification program that is recognized, so that they have completed whatever sort of training and work requirements that their location requires, and that now they have some sort of official certification to say they are a CHW.
Okay, so we have another question. What issues did you encounter during the launch of this project, or within the project itself as you were, building upon it?
Mikayla, do you want to take that one around the survey?
Oh, okay. Are we talking survey? So, for the survey size that we have put together, I have to say that we have encountered very minimal barriers. We had a team that came together and they were dedicated on working on these issues and really identifying what questions needed to be asked to this population. We had stakeholders who came in and helped us launch the survey. We had experts who came in to help us analyze the survey. The barriers, I would say, is really reaching everyone that we possibly could have. We did the best that we could by networking. I mean, all of the leaders kind of passed it to a friend, right? They said, we have this survey. It's very important that you take the survey. These are the pros of filling out this 51 question survey. So I guess my only barrier that I would say is the hopes that the next survey we reach even more people.
Okay. Yeah, that's always a problem, trying to find, your network and get the word out. So the next question we have is, can becoming a CHW help a fresh out of college certified health education is added into their gain experience?
Yeah, I think that's a great question. I think doing sort of CHW work, which is often doing a lot of direct community service, getting to talk to people, can be really valuable as you sort of do that work. If you felt the need to sort of do additional training in CHW training, I think that can be really valuable. When we talk about community health worker training, because it's different in all different areas, we often refer to the community health worker core competencies, which is often called the C3 project, which is things around motivational interviewing, connecting people to social services, doing kind of literacy training and all sorts of other skills that may or may not be different from the training you've already received.
Okay, thank you. So another question we have is, in our state, our AHEC or Area Health Education Centers do a lot of work to support CHWs. Does your organization connect and support area health education centers?
Yes, so it varies from sort of location to location. In some states, AHEC is definitely, as you mentioned, Allison, one of the main folks who might be training or providing education for CHWs. And in those instances, we are connecting with AHEC. We also have a list of training programs on our website, some of which goes through AHEC. I also know a lot of local and state community health workers associations are working with AHEC. So we're also working with them through that sort of feedback loop, if that makes sense.
Okay, thank you. So here's another question. This is directed to both of you. It says, Mikayla and Aurora, personally speaking, what is your favorite thing about being a CHW?
Mikayla, do you want to take that one?
Yeah, I'd love to. So for me, it's being able to give back to my community, helping people in the same ways that I have been helped. This is a profession where you have to practice empathy and compassion every day. You take a lot of indirect trauma on for other people, and as you build them up to be self-sustained in their community, giving them the tools that they need to live a greater life, get connected with their kids, get connected with resources so that everyone has a fair chance to live a life worth living. So that's what it is for me. Thank you for the question as well.
Yeah, and I actually don't identify as a community health worker, but a community health worker ally. Before I came to work at NACHW, I worked at a community-based organization that served immigrants and refugees, and I worked alongside community health workers. I also did do some of the sort of social services and connecting community that community health workers do. So that's also my path, but I love working with community health workers. I think, as Mikayla mentioned, the sort of empathy, the sort of going above and beyond for community members and for sort of health and social justice is just a really special thing to get to be around.
Thank you very much. So this is a question we might need to have the person that asked it elaborate a little bit, but it says, what kind of questions did you wish you could have asked? And I don't know if that's in relation to the survey. Maybe I'll have Ursula, if you could maybe elaborate on your question in the chat, that'd be great. And I'll go on to the next one. So what's the best way to ensure that people here today hear about the findings report of the survey results? Would that be maybe by joining your newsletter?
Yes, I think joining the newsletter is a good bet. If you're more of a social media person, if you follow us on any of our social media platforms, we're definitely going to be doing a big push once we sort of get all our findings out into our report.
Right. Thank you. Okay, and another question: what are opportunities that could be? Let's see. What opportunities would there be for local community organizations to support local or national CHW networks outside education or hiring? Or put another way, with unlimited resources, what would be the ideal project that you would want to tackle as a national organization?
That's a really great question, a really big question. I think a lot of CHW sort of networking and community building has really been done in sort of the last 5 years. I mean, there's been community CHW organizing for decades, but sort of CHW networks connecting to each other is sort of a new thing. So we at NACHW are sort of working right now to continue to be connecting CHWs with each other, connecting CHWs who are working on similar topics. And I also think one project I should mention that is a project we are taking on is creating a CHW national registry. This is a long-term project, but that will be a place where hopefully CHWs can join and get job opportunities get announcements if we have federal announcements around, changes in Medicaid or pandemic readiness. So that's sort of the national project that NACHW is taking on, but that's going to be a several year initiative.
Thank you. So this is in relation to the original question that Ursula had asked. Did you do any focus groups for qualitative data or just use surveys?
So initially, we have just distributed this survey, but we are using the CHW leaders as a focus group to come in and analyze this data in their own hands. And we've also got data experts internally and externally from Yale with eyes on the data to come up with those themes and topics from this survey, in addition to what we have already seen.
Okay, the next question, is there any advocacy work being done to increase pay of community health workers? And as you mentioned, a lot of people do the work and don't receive pay or must work an additional job to support themselves. As community health workers do essential work in the community, what is being done to attract and retain these essential workers?
That's a really great question. So we do advocacy around pay. We often keep it sort of, our general recommendation is to pay a living wage. The reason for that is because we never want to go against what folks are advocating for on a local or state level. So we sort of avoid putting sort of a number in case folks at a local level are advocating for higher wages than what we might say. So there are definitely a lot of campaigns at the state and local level to increase pay for CHWs. There is a general issue, as you're suggesting, around sustainability. CHWs are often paid through short-term grants. There is in some states a little bit of Medicaid reimbursement for CHWs, but often not enough to sort of pay a living wage for somebody. So it's often organizations sort of putting together multiple funding streams. So what we as NACHW would like to see is greater sustainability, longer term grants for CHWs, CHWs getting paid for some of the work that is often not valued, doing some of the work around getting ahead of sort of chronic diseases, getting ahead of social services needs, which can sometimes be hard for folks to justify. So the answer to your question is sort of yes, and there's a lot to be done to increase pay, to increase access to benefits, and so on and so forth.
Thank you. Okay, so here's another question. So were there any questions that after you finished the survey, sent it out, and started getting responses that you realized you wished you would have asked?
We're beginning to see a lot of the important themes that we had imagined. The CHW leaders who constructed this survey are the boots on the ground. They're working in various communities throughout the US, so they know what the same stories that this survey has being told. I guess my short answer is I don't know because we didn't ask, right? But we can, we definitely have room for a follow-up survey if that's what we need to do. But we feel like pretty strongly about the results that we've received and the stories that they tell.
Okay, thank you. Let's see, here we go. Do you see any CHW resource apps in the future?
That's
so maybe something, yeah, that's a great question.
A really interesting question. I'll say there is interest, and we've gotten sort of requests to comment on people making apps around specific issues. Like there's been some development around someone wanting to make an app for CHWs who work in diabetes. So it's often sort of spliced out by sort of expertise or specialty. We don't currently have an app, We do have a website that we're going to be working to kind of completely revamp in the next 6 months. The other sort of issue that we're always thinking about is that so many community health workers are serving communities that don't necessarily have reliable broadband access. So that's also part of what we want to make sure that we're advocating for, that folks don't only put resources into these, very useful sort of apps and technology, but make sure that first we have as many people as possible being able to access those.
Great. Well, thank you. Well, looks like we're kind of at the end of our questions. Does anybody else have any last minute questions? Give everybody a minute or two to think that over. Okay, well, I don't see any coming into the chat. So I guess actually then we'll go ahead and wrap things up here. So again, we just really, those of us from Region 3 that work on Health Bites want to thank you all for that really wonderful presentation. And it was certainly a pleasure to have you here with us today and letting us know all the great things that are happening in the community health worker arena.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.